Hey everybody, Dr. Barron here with virtualheadache-specialist.com. Happy Saturday. I figured I'd chip away to a couple of these questions. We're going to hit this one first, treatment options specific for vestibular migraine. I've had a lot of questions about vestibular migraine. It's a very frustrating, it can be a very debilitating, intrusive into life disorder and symptoms. So let's get at it. And so first of all, let's define it. And I did a previous video on vestibular migraine. You can look back and it talks a little more detail about it. But just to kind of highlight the definition of vestibular migraine is that you have to have a history of migraine headache, and by criteria from the ICHD-3, which is the International Classification of Headache Disorders, associated with those headaches are dizziness symptoms, vertigo symptoms, vestibular symptoms, we call them. And there's a lot of ways people describe these symptoms from those terms: disequilibrium, balance off. There's a lot of ways that people feel, but it's kind of the same concept. And by that criteria, those symptoms should last anywhere between 5 minutes up to 72 hours associated with a migraine attack. Now, keep in mind, the symptoms should be linked with a migraine attack at least 50% of the time. So what that means is that you could still have these episodes of vertigo, dizziness, etc. without a headache, and it could still be migrainous, just like migraine aura can occur without a headache. And so it's important to keep that in mind, but you have to have, by definition, at least 50% of those vertigo symptoms associated with a migraine attack. So diagnosis of exclusion is what we call this. So that means that you always want to have other more common causes of vertigo, dizziness ruled out. Most commonly, these disorders come from the inner ear, the ENT type of disorder. So ENT, ear, nose, and throat doctor evaluation is always a central piece of the evaluation. You want to have a full evaluation, rule out things like Meniere's disease, inner ear vestibular problems. Vestibular testing is often part of this. I usually suggest getting a brain MRI with specifically what we call IAC/CPA, internal auditory canal / cerebellopontine angle cuts, and that gives you a closer in view of the inner ear canal vestibular apparatus. So it's better than just a regular MRI to look at those structures. So I like to do that, and it should be done with contrast. Treatment for this, think of this really, the symptoms are different than what you typically think of migraine, but it still is an electrically based problem. So it is still treated and targeted electrically, just as any migraine is. So this is what we consider a migraine equivalent syndrome, and we equivalently treat it similarly. So often the same types of medication trials, the same targets for these medicines is how you treat it. And so treatment of vestibular migraine, I wouldn't say there's a specific thing that is specific only for vestibular migraine, to answer the question here, but we do treat it with a number of options. So for one thing, just like any migraine, you want to make sure you have excluded triggers. And I have a couple blog articles on my website, several blog articles that detail a lot of trigger types of things to watch for migraine in general. There's also a vestibular migraine blog that I wrote on the website. You can look that up. So typical conservative things, looking for triggers, conservative measures, hydration, and maybe some supplements. I have blogs on all these things as well. Some people benefit from vestibular physical therapy. If there's some benign positional component, benign BPPV or benign positional vertigo, we call it. Some people have that, and that's one of the big mimickers of vestibular migraine. That often is more responsive to vestibular physical therapy than vestibular migraine typically is. And then beyond, the conservative types of things, then we start to move to medication. So usually this being an electrical phenomenon, it's based in the circuitry of the brain. Usually I like to go after electrically based treatments first. So this is going through some of the anti-seizure classes of medicines, seizures are a different type of an electrical disorder, but migraine is also an electrical disorder. And so that's why the anti-seizure medicines are often used to suppress that overactive circuit, which for patients with a vestibular migraine is causing vestibular symptoms. So these are things typically like, Topamax medications, zonisamide, sometimes, there's some others too, but those are often the ones we use. Sometimes we actually try gabapentin for this, for vestibular dizzy type symptoms. So those are often used first. Other options are antidepressant, anti-anxiety medicines. With the most common effective ones being things like amitriptyline, Effexor, Cymbalta, and then the blood pressure medicines are in the different, in the realm of things to use for migraine in general. These are things like propranolol, metoprolol, atenolol, lisinopril, losartan, verapamil. Sometimes it's kind of fallen out of the guidelines a bit, but still sometimes people can respond to that. And then, once you get through at least two of those historical categories, then you can often move on to the CGRP medications. These are the CGRP monoclonal antibodies, once a month injectable medicines. These are the GPANT medications. I just did the video prior to this on CGRP inhibitor medication, so you can look back and that will detail more about those kind of medications. I have a lot of patients that will move to Botox for, and Botox is approved for chronic migraine, so 15 to 30 days of headache with at least 8 migrainous days in the mix. And if vestibular symptoms are a component, I often do see those vestibular symptoms improve along with the migraine when the Botox is working. So that's certainly something to keep in mind. Some people feel that neuromodulation devices can be helpful. I'm going to do a video on those coming up sometime soon. Vagus nerve stimulation, I've seen some people feel that can be beneficial. We just need more evidence and data and studies looking at these things. But those are typically the basics of how we treat this. And based on that, we certainly will go beyond that. But I would say those are the first line, top level things to know about vestibular migraine, the disorder itself, and really how to treat it. So hopefully that gives you some place to start with conversation with your doctor. If you have other questions, feel free to drop them in the comments, and I will work my way through those. Okay, you guys have a good rest of the Saturday. All right, see ya.